So you want to know what treatments are available for your erectile dysfunction? Well, this video is all about non-surgical treatments for erectile dysfunction. Welcome to HEALTHdrum. I'm Dr. Bert Worstman, a urological surgeon and former researcher. And this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. If this is your first time on the channel and you want to know all about good health, go ahead and subscribe below. Like you, many are also interested in digital health, so feel free to reach out with an email or hit the comment section below. Also, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. So let's get into it with a summary of what this video is about. So this list summarizes the talking points of what we will cover in this video. Lifestyle factors causing erectile dysfunction, or ED, and also known as impotence. Medications responsible for ED, non-surgical treatment options, combination therapies, and then some information about performance anxiety and low interest in sex. So let's get into it with the next screenshot about lifestyle factors that can impact erectile dysfunction. So erectile dysfunction or impotence is defined as a failure to maintain a rigid penis for satisfactory sexual intercourse. It is increasingly common after the age of 40 and often connected to lifestyle choices such as overeating, which can lead to obesity, hypertension, and diabetes. And these diagnoses often lead to many other medical conditions, doctor visits, and costs. Also, smoking and alcohol abuse are major contributors to erectile dysfunction. So if you have any of these conditions, you should try to make the lifestyle choices to overcome these problems, not only for the ED, but also for your general well-being. So this is a partial list of self-care lifestyle choices or preventive measures that you can take that are recognized as being important not only for improving and maintaining erectile function, but for your general well-being. This list includes the adoption of a predominantly plant-based diet, getting to a weight that's normal for your height, getting moderate amounts of regular exercise, cutting alcohol intake, and quitting smoking. Every person should know their blood pressure and get evaluated and treated if serial measurements of your blood pressure show that it's above normal limits. So one of the most common causes of erectile dysfunction is medications, both prescribed and over the counter, and the following is a grouping of some of the more common medications causing ED. So the actual list of medications that can affect erections is far too long to include in this video. Most of them, however, can fall into the 5 groups listed: prostate medications, blood pressure medications, especially the thiazides, cholesterol, mental health, and chemotherapy drugs. Now, the best way for you to sort this out is to go online and see if your medication can impact erections. Then you can check with your doctor that prescribed it and see if there's an alternative drug. Many of these medications may impact not only erections, but also the ability to ejaculate or have an orgasm. As well, some can impact libido or desire for intercourse. So let's move on and see what sort of non-surgical treatment options are available for your ED. So the easiest solutions are medications. The over-the-counter products such as arginine supplements or Eroxon can be worth a try before trying various PDE5 medications such as Cialis, Viagra, Levitra, or Stendra, and others. Alternatively, yohimbine can be tried, but this needs a script and is of questionable benefit. Most of these drugs can be tried despite being on other medications for other conditions, but you need to be aware that all medications, whether over the counter or not, have potential side effects. Also, most of these medications can be easily sourced online without the need for detailed and expensive medical evaluations. These medications may not all work, and some have annoying side effects like flushing of the face, nasal stuffiness, or indigestion. However, unless particularly troublesome, many side effects will gradually disappear with prolonged use, and just because one of these medications gives you side effects doesn't mean that the other ones will do the same, so it's worth trying the different PDE5s. Over time, however, many of these medications tend to lose their potency and increases in the dosages may be required, even going well over their so-called maximum limits if tolerated. Now, if these medications only work partially, or you get side effects that can't be tolerated, then other options such as restrictive devices or vacuum devices may help you get and maintain an erection. These devices can also be purchased online. Alternatively, you can use alprostadil or Muse intraurethral suppositories or pellets and insert these into the opening of your penis using an applicator. Unfortunately, few samples may be left in stores as the drug maker has discontinued production of Muse in 2024. On the other hand, you can be instructed on how to self-inject alprostadil, otherwise known as Cavajet or Edex, with a tiny needle into the base of the shaft of the penis. So if your libido is normal, but none of these non-surgical treatment options on their own seem to help, you may have to try a combination treatment. So if you're tolerating the PDE5 medications like Cialis, Viagra, Levitra, or Stendra, but your erection is not firm enough despite increasing the dosage, you can consider combining the medication with various other non-surgical treatment options. In addition to one of the PDE5s, you can add a confidence ring or a vacuum device. This can be very helpful for those who can achieve an erection but can't maintain it. Both restrictive devices and vacuum devices can be purchased online without the need for a prescription. Alternatively, you can try the Muse intraurethral pellet that you insert into the opening of your penis if it's still available, or the Cavajet or Edex intracavernosal injection. Both of these require a visit to a urologist and a prescription. On the other hand, office-based low-intensity shockwave therapy to the penis is another possible option that can stimulate an increase in blood supply to the penis and then enhance erections. And if your morning testosterone level was proven to be low, testosterone replacement may be helpful. So let's look at the next screenshot that addresses low libido or low interest in sex. So there are several drugs like the cholesterol medications that can lower your desire for sex. If a change in the medication you think is responsible for your low libido doesn't resolve your problem, check a morning testosterone level. If the testosterone level is still low on a repeat measurement, then consider a form of testosterone replacement. Now, there are many forms of testosterone replacement, from gels to patches to injections and implanted pellets. You need to be fully aware, however, that testosterone replacement does come with risks, such as increasing the blood pressure and other problems. As well, the testosterone may not normalize libido or your erections. Also, it's possible to be troubled by ED for several years and then also be impacted by a gradual drop in your testosterone levels as you age, otherwise known as a male menopause. So another concern that can be considered under the umbrella of erectile dysfunction are performance issues. Let's check this next screenshot. So both performance anxiety and premature ejaculation are very common performance concerns. particularly in younger men and especially with a new partner. So performance anxiety is the failure to get an erection, although routinely being able to do so, while premature ejaculation means ejaculating before you or your partner would like. Masturbating some hours before anticipated sexual intercourse can make the next erection much less likely to be affected by performance anxiety or premature ejaculation. As well, there are medications like Prozac that can delay ejaculation. Delayed orgasm can be categorized as a performance issue. Again, this can be due to anxiety or because of various medications such as mental health drugs. On a side note, and not really under delayed orgasm, but women routinely take more time to reach orgasm than men do, and more digital and/or oral stimulation will be required for them if climax is not reached during penetration. So we've discussed several preventive measures for erectile dysfunction as well as several non-surgical treatment options. You should also be aware that prostate cancer treatments are a big cause of erectile dysfunction. All prostate cancer treatments such as robotic prostatectomy, radiation and proton beam options, radioactive seeds, HIFU or high-intensity focused ultrasound, and focal therapy options using cryoablation or laser can lead to erectile dysfunction. In fact, prostate cancer treatments and their drugs like Lupron are responsible for a great number of limp and leaking complications. In fact, to such an extent that physicians have employed pre- and post-operative counseling programs to manage patient expectations. I have other videos related to these subjects. So let's recap. In this video about non-surgical treatment options for ED, you learned that ED increases with age from about 40 years on. Check your blood pressure to make sure that it's normal. ED is often due to medications. The PDE5s are a good first-line choice, and combination treatments may be needed. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.